MPP Brownell, we just saw your presentation here at the hospital. It was a great tribute, and the hospital gave you a great tribute. It's election time. We're seeing a lot of messaging in some of the more conservative media locally and around the province. There's a lot of rhetoric. There's a lot of things that are old school politics that are coming out. I know you're not running, but I could tell that sometimes you'd love, if you were running, what are some of the things that you say to combat some of the things that are being out there? Well,
I can tell you right now, healthcare in my community has been number one. And it infuriated me today to find in a local press that there was mention made that we're doing this today or doing other things just because there's an election. Absolutely false. And I can look at your camera right in the eye and say that's absolutely false. I don't need to be standing here on an election platform because I'm not in the election. I'm here because I believe in the hospital, and we have a wonderful record here in this community to run on. If you want to get into the party politics, as Liberals, we've got a wonderful record to run on here in this riding. Hudak came into the riding yesterday to talk about agriculture. 4 things he talked about. Those 4 things we've already tackled. We've already put in risk management plan. We had a pilot program. We said this year that there will be a risk management plan. That's off the table. We've always, for years now, have said that supply management, there's no negotiation in supply management. It's there. With Foodland Ontario, we have been huge boosters of food, even with boosting Ontario food in the legislature. For Hudak and his team to come into the riding and make comments that they're going to be the savior and the salvation of everything that has to do with agriculture, they're absolutely wrong. And I can look at every farmer, and I can look to every constituent in my riding of Stormont, Dundas, South Glengarry, and say that we have done it. And actually, what I read in the press, I wasn't at the meeting. I had a meeting in Toronto yesterday. But what I heard at that meeting, we've already done it. So there was nothing new in the message that I received from yesterday.
Mr. Hudak's team is also talking a lot about healthcare, but after the devastation to the healthcare system during the Mike Harris years, how would you respond to those?
Well, I'm here at the Brownell Community Hospital at this moment, standing in the very room that a minister of health at the time came into this hospital and said that the check was in the back pocket for healthcare improvements at this hospital. The check wasn't in the pocket. The work hadn't even been done to amalgamate the 2 hospitals. That's what we had to take over. We had to take over that. And I can tell you, I knocked on doors, and we had a province that listened, that understood our problems here in the community, and did something about it. And I'm passionate about that. I was passionate about the healthcare and the funding that was required in this province when I got elected in 2003, and I'm just as passionate now. And for anybody to say that because I came to the Brownell Community Hospital today, or because I've stepped out to announce this or that in the riding, I've been doing it all along. I've been doing that all along since 2003. So nobody has to say that it's an election platform that I'm on. It's not.
All right. Thank you very much.